Manchester, the north of England. A city known for its music, fashion, football and dentistry. Based in Wilmslow, Transform Dental is changing the way dentistry is done. Welcome to digital dentistry.
Dr. Hadi. Is he still in the room? We have it all at Transform Dental.
So when you actually get like 3D scan on the screen and they can actually explain the different things that they can do to your teeth with the smile, with the colour, with the structure.
Good morning, Transform Dental. Beauty speaking, how can I help?
Good morning.
Good morning.
How are we doing today?
How are you?
Not too bad. Is Mateen in the back in the lab?
Mateen is in the back in the lab, yeah.
Has she received a package?
She has.
She has?
Yes.
Good. Great. I'll go and have a look. Just make sure the practice is looking nice and neat throughout the day, please. Diffuser on?
Yes, of course.
I'm just immune to it now. I can't even smell it myself. It's more important to have my coffee ready.
I've got your coffee.
Can I have my coffee, please?
Yeah. Oh, wait,
you can pass over. Yeah, pass over here. Thank you. Thank you for that, Beauty.
You're welcome.
All right, lovely.
My name's Beauty and I am a dental assistant here at Transform Dental. It's just not the same like other dentists. We are very relaxed, we're very chill. Our practices look like spas, they don't even look like clinics. Let's start there. You're not going to get that initial fear of entering the dentist. It just feels like you're going on a little spa, a little relax. Dr. Hadi, I've got a lot of respect for Dr. Hadi. He's just so business focused. He's so respectful in surgery. He always says please and thank you. And our dental assistants know that we really appreciate when dentists say that. But it's very life-changing and he makes you very motivated in life, yeah.
So today we are here at Transform Dental in Wilmslow, one of our 3 sites, and we're going to start a documentary about what goes on in Transform Dental. And I'm going to show you around Wilmslow Clinic. So if you want to walk with me, I'll show you around. So here, obviously this is a very nice relaxing waiting area as you can see, but we do also have a treatment coordination room or more of a VIP room where patients who have longer treatment can spend time, especially if they're waiting in between the work, the procedure. If they need to wait around, they can just come in this room and just relax. So it's a nice cozy room here. We also discuss treatment plans with patients here. The treatment coordinator will come in this room and go through all the options with the patient. Again, a mini bar here, coffee machine, drinks for patients to help themselves during the visit at Transform Dental. All right, let's walk through. Again, this practice was designed by the same designer who designed Liverpool Transform Dental. The theme is quite similar, but there's subtle differences between the 2 practices. We didn't want to have sort of the same look for all practices. We like to keep them slightly different, but the same theme goes around where it gives the patient that nice relaxing spa theme. So when they come to the dentist, they don't feel like they're at the dentist. Nice corridor taking you to surgery 1, which is currently in operation. There's a patient and dentist in surgery 1. Let's go upstairs, have a look. This takes you to the second waiting room, again for patients who are going in surgery number 2. Big spacious area for patient to come in, quite private. We tend to have 1 patient at a time where a patient can just have the privacy during the visit with us. All right, take you into the management room. We've got Tony in house. Hi Tony, how are you?
How are we?
How's it going?
Good.
How's your day been?
Busy.
Busy is good.
Busy is good.
Busy is good. Everybody behaving?
Everyone's on best behaviour today.
Good, excellent.
Nothing to report.
Can you tell us what you're doing today? You've got all those screens on. What's happening?
I've got all my screens. So we've got Liverpool up here. Obviously we're at Wilmslow today. few messages from London back and forth, and if you've seen them.
Right, yeah, I had a look here.
Catching up with everybody.
I've got a busy day today. I'm seeing patients.
You are.
So I'll be busy seeing my patients.
Ready.
Aligners ready, all looking good. Need to go and see Martine in the lab.
Yeah.
But yeah, all looking good. So I've got a busy day ahead, and I'm excited to do some dentistry.
Yeah. My name is Tony. I'm the regional manager for Transform Dental and Made in London. I have been here for 5 years. Started at the bottom, worked my way up to the top, and I have been doing this role for the past 2 years now. A day in my life is probably a 24-hour day for me. Wake up, make my way to one of our clinic locations, greet the team, speak with patients, obviously very involved with everything behind the scenes as well that not everyone gets to see, but are really important in kind of the day-to-day runnings of the clinic. And yeah, so get home, have a quick bite to eat, and then get back on it with everything. So yeah, no rest for the wicked.
You've done the hours.
I've done the hours, catching up on some figures now.
Right, okay. When you visiting Liverpool next?
Tomorrow.
Tomorrow in Liverpool.
Yeah, they're tomorrow. We're there Wednesday. So yeah, I'll have my figures to you by the end of the day.
Exciting. Okay, I'll come and have a little chat with you later on.
Yeah.
About marketing.
Yeah, tomorrow.
And what we do next month. Right, I'll take you out to our second surgery here. So when we took over this site, this room wasn't a dental surgery. We used it as storage. It was a single practice, single clinic practice where we just had the one surgery downstairs, and then we expanded, put another surgery upstairs. We do have room for more surgeries, but we like to keep our clinics quite exclusive, not too many rooms. Again, it gives it that spacious feel to our patients where they don't feel really cramped in a building. You know, there's a lot of space, and it's nice to have that for our patients, to be able to offer that to our patients. So this is the second surgery. I'll be seeing some patients himself once I've done this. Again, you can see a big room with a lot of light coming through, which is useful. Obviously, when you're doing shade matching and things like that, it's good to have a natural light coming through. So yeah, let's walk down to the lab. So I'm just going to walk you through decontamination room. Again, very important part of being a dental clinic. You've got to make sure you've got good sterilization process in place. You can see this is a very clinical, bright room, clean, basically spotless, where instruments come in for cleaning in this room. And then we go through, got the lab here. Hello. Good morning, Martine. How are you? How is it going?
Good. Not bad.
Right, so what are we doing today?
Just these aligners.
You're doing some aligners, perfect. Aligners and some veneers. I can see you've crafted this beautiful 3D printed crown. Again, this is all done in-house. You can see this is ready, well, pretty much ready. It just needs some staining and polishing to be fitted. What we like about having this on-site lab is obviously everything's done within the same building, which gives us more control in the service we provide to our patients, so we don't have to rely on a third party where there may be delays with things coming back. Here in the lab, things can be discussed. The dentist can discuss what the needs of the patients is with the technician, which makes the outcome more predictable and more pleasing for both patient as well as the dentist. Martine's very busy now polishing some aligners. We also do our own aligners here where we make the aligners. Again, it speeds up the whole turnaround process for patients. Rather than waiting weeks and weeks, we can turn the work around in a shorter period of time. Digital dentistry here, as we do have in Liverpool. We've got 3D printers, different 3D printers, the vacuum down machine, sandblaster, and you can see Martine's got some models there on the screen, just getting ready to be printed. So Mateen, tell me, what do you enjoy the most about your work? Do you enjoy doing this or doing your staining and your veneers? What do you like doing more?
I like staining more.
We talked about dentistry being an artistic profession where you have to really enjoy doing artistic work, staining the teeth, making them look really natural, because a veneer isn't just a block of resin. Tooth usually has different characterization, different grooves, fissures, and it's very important to make him look, to make him lifelike. You need to put those little details in him for him to look natural, and that's where the skills of Mateen obviously comes into, where she put those little details into to make him look really natural and lifelike. And she enjoys doing that. That's actually something I enjoy doing myself, and sometimes you find me in the lab when I want to hide away from everybody. I come in the lab and I spend a bit of time doing some of the staining, just trying different things, seeing what works best. Everything that we do in the lab is approved by myself. From my masters, I spend a lot of time in the lab doing lab work. So, because as a dental student, you don't really get taught the lab side of things as much, but because I had a great interest in it, I kind of had that interest, and I always spend time in the lab trying things out. Plus my masters helped me gain more skills. You know, every work we did for the patient in the hospital, we would go back in the lab and manufacture the prostheses or the veneers, the crowns ourselves, and that has been really useful where I come in, and all these work are kind of overseen by myself, making sure the TD stamp is on every case that goes out to this door, which is very important. All right, Mateen? Have a good day. All right, I'll see you later on.
You too.
All right,
You.
take care.
Thank you so much.
So here you can see we've got the 3D printer machine, same as the one we have in Liverpool. 3D printed machines are used to print out models, print out veneers, crowns, night guards, all sorts. This is what we talked about when we said dental technology is important, you know, advanced technology, where it can make life so much easier for our patient as well as our dentists. So this is what we use to print out all those things. And then if you have a look here, this is our autoclave, where all instruments get cleaned. Following the protocol, you can see the protocols all in a photo frame on the wall, where dental assistants can remind themselves what protocols they need to be doing throughout the whole procedure. Like I said, it's a very much clinical, clean room here, starting with the dirty zone here. So instruments come in, start here, go through the cleaning process, and make the way to this side where they get cleaned, pouched up, and taken back to their surgery for use on patients. So going back to this printer, the 3D printer, again, this gives us that control over the work we deliver to our patients. We're not having to rely on a third party to do the work. Everything is done digitally. So we scan the teeth, and then once they're scanned, we design. So all done on the computer. Once they're designed, we send the design to this printer, and they start printing out, whether it's a model like this. So you can see the resin, there's resin in here for different purposes. So for a model resin, you'd have this color resin. For a crown or a veneer, you use this. If you want to have a quick look at this, just to show you, so that resin there turns into this. You can see that's the resin. This is the platform where the veneers and crowns are made, and then within half an hour, 20 minutes to half an hour, you get something like this printed out. Obviously it wouldn't be in the exact same format, it will need some polishing, but you get something similar to this and then hand it over to the technician to finish off and do the polishing. So what I like about having this on-site lab is it gives us the control over the work we do. We can decide how quick we can do it, and we try and do it as quick as we can. We can quality control, we can make sure we are delivering exactly what we want to deliver to our patients, rather than sending work to a lab and just relying on the lab to send something back that would be acceptable to us. We're actually in control of what we send in or what we're giving to our patient, delivering to our patients. Right, okay, how are we doing? They're filming me today. We're filming around.
I'm not surprised.
Are you happy to be in the film?
Absolutely, yeah.
Yeah. So a very good patient of mine. I've known him for years. I mean, not only him, the whole family.
Yeah.
You know, kids come here as well.
You do? Leo is having his
Invisalign treatment.
Yeah.
Yeah, I saw him not long ago, actually, a couple of weeks ago. Have you been offered a drink? Would you like a coffee or anything?
No, I'm fine. I have been offered, yeah.
Okay, good. You have been offered. You passed. So, yeah, tell us what you like about coming to Transform Dental.
Well, I've been coming for many years. I suspect it's about 10 years now.
Yeah,
And
God.
as you said, my children, my wife, everybody come here. And it's great. Every time we have a problem, you solve it. So that's simple.
I'm glad to know. We have a lot in common. We like our cars. Porsche driver. I used to have a Porsche, and we used to talk about Porsches.
It's going into bigger things now.
No, small. I've gone smaller. Bigger things, yeah, maybe practices, but no, not so much into car. So yeah, it's nice to have you back. It's good to have obviously loyal patients that keep coming back to us, and yeah, always is definitely one of them, and it's always good to see him.
Well, thank you so much.
All right, absolute pleasure.
A gentleman, top man here.
Thank you.
Thank you. Cheers.
So it's nice to walk in actually, because some of the patients, especially when I was away in London, and it was scary for me when I was moving to London, because I had a patient base here where I was seeing them for years and years, and then moving to London, passing them to other dentists was a bit scary. But then it worked out well, because like I said, the standards, we try and make sure the standards are maintained by every single member of staff here. So what I do would be the same as doctors after Dr. Blau or anybody else does. And it's nice to do that. And obviously this is the evidence, you know, patients are still coming back, and it's nice to see them. And sometimes I walk in and see a patient I haven't seen for a couple of years, but I still remember them, still remember what treatment they had, you know. Still remember the family members, and it's nice.
You find that a lot when the one person comes, they kind of bring their family after.
Yeah, usually they do. And like I said, word of mouth is what we really work on, and it's nice to have that free marketing, if you like. You know, we don't need to do anything on that side. It's just patients going away and telling their family members or friends, and having them come to us. It's a nice feeling. It's a nice feeling. And what I said before, this for me, it's always been a family atmosphere. It's always been a family. You know, all patients, especially longer-standing patients, feel like another member of the family. It's not just a team that feels like family; it's the patients as well. So we really work on that and make sure everybody feels really welcome when they come here. Yeah. And it's nice to have that feedback from patients. All right. And I hope we carry on with that, and you know, make sure we always do that. And that's the first and most important thing for us, ensuring that patients feel like that when they come to us. Yeah. Good. Thank you. You sure you don't want a drink?
No, absolutely. Fine. No, fine. Thank you so much.
He likes his cigars as well.
That's why I have to come so often. So I my teeth clean, you see.
Do you still smoke your cigars, or is this smoking?
Just had one before I came.
You had one before. But then coffee is nice with the cigar, isn't it? Maybe don't put this on the camera. Encouraging him to smoke a cigar. All right.
Cheers.
Right, okay. So should we quickly go in surgery? Dr. Tam, how are we doing?
Okay.
Right, how's the day been?
It's been it's been a good day, a busy day.
Busy day, we like busy days, hey?
Yeah, just
loving that smile, shining, hey? So, how's your day been?
Yeah, just a very mixed bag. We've got a few veneer fits coming up, we've had a couple of emergencies, a couple of consults, some 3D records, so yeah.
It's nice to have a mix of different things, so you're not just doing the same thing. It's not your routine.
It's never
check-up.
Yeah, every day is different. And every patient's
different. And that's the beauty of this work. Every patient's different. You got to tailor that to the design, to the smile makeover you're giving to the patient. It's always important.
You get some patients who just want a little natural, subtle enhancement. You get some patients that they want everything changed, you know this.
Yeah.
all ages, all sizes. Yeah, very.
I think patients are changing more to a natural look.
Yes.
I remember a few years ago when we were a patient coming in, every single one would ask for that whitest, fakest look.
Yeah.
Whereas now people are going more for the natural look, which is nice, and harder for us as dentists to do that, because replicating a tooth natural shape and colour is more difficult than
giving. It's not one
them...
size fits all anymore.
Exactly.
Before it was everything straight, everything one size, one colour. Now it's matching it to that patient, and sometimes it's a case of informing the patient what's going to work better for them, and having that kind of having that conversation with them.
I think the design itself, when we take the pictures and the scan, the design itself, you kind of seeing beyond the teeth. It's not just about the teeth.
Absolutely,
it's about it could be the patient facial profile, it could be the color of the hair, the how feminine the patient can look. All those things
determine the white of their eyes, how centered, or how the lip line, everything, the facial shape. This is what I really like about these 3D veneers, because they're very, very thin, very subtle. They're not too thick, not too bulky, and obviously with the design technology that we have, it's bespoke to that patient. We've got really good results.
And easy for dentists to do, would you say?
Yeah, very, very straightforward. You get a couple of tricky ones, but we like the challenge. I think it's.
We like the challenge. Yeah, we definitely do like the challenge.
How did you hand select Dr. Tam? How did you meet?
Dr. Tam is obviously what we usually look for, somebody who's got desire for cosmetic dentistry, because some dentists find it quite challenging and overwhelming. Somebody who likes cosmetic dentistry, somebody who's a good listener. A lot of cosmetic dentistry is about listening to patient, because you can try and convince the patient to do something you want. If you're not listening to patient and not giving what the patient wants, they're not going to be happy. So for me, rather than preaching out to my patient and telling them, do this, do that, do whatever, I'll give them all the options, let them know advantages and advantages of both options, or however number of options they have. But more important, I listen to what they want, and try and deliver on that. Give them what they want, make sure patients are happy. And
it is definitely not prescriptive. It's kind of co-diagnosis, they call it.
It is.
You and the patient sit together and you talk about what you establish what their goal is, and then you go on that journey together to achieve it with them. But it's not one-way traffic. It's not you telling them, and then you work together.
It's mutual, isn't it?
It's very mutual.
Mutualistic relationship.
It's a really nice relationship. Yeah, and you do build a relationship with the patients. You start to discover a lot about them outside of here. It's nice, and it's when you get that reaction when they first see their teeth, and and you can tell so many of them, the regret that they have is they didn't do it sooner. They come and say, I wish I did it sooner, because you can see that.
You know what I like about it? It's quite instant. You don't have to wait months and months.
No. Absolutely, quick.
For a result, patient walking and
that's
an hour later.
A reflection of society now, that we want things quick.
Yeah.
We order things, we want it now, we want it tomorrow. If Amazon delay it till Tuesday or Wednesday, we're like, where is it? And same with the teeth. People don't want to go for years of treatment. They want something that's going to be quite instant, and it's nice and easy to maintain. And they like coming here. So many patients, they come and they tell us how lovely the practice is, how got the video up there, and lovely team.
Doesn't feel like a typical dental clinic, does it?
Oh, yeah.
Dr. Tam's actually from Yorkshire. He's a Yorkshire boy.
Yeah.
Not originally. London, did you say you were?
Originally from London. Originally from London, yeah. But
Yorkshire boy. Still kind of lives in Yorkshire, but is in the process of moving. But yeah, somebody who's is a good listener. Somebody who. Communication is key, because all these dentists, every dentist, obviously they've had the same training. Some may be more experienced than others, but then again, we look for somebody who's up to date with the advanced technology. There's no point hiring a dentist who's got 20-30 years experience of old-fashioned sort of dentistry. We want somebody who's happy to embrace the new technology and be able to implement it in their everyday work, which, like I said, it's all about predictability, ease for patient, quicker turnaround, and a long-lasting result. So Dr. Tam definitely ticks all those boxes. Excellent. And more importantly, he's a nice man. He's a nice man. It's nice to have nice people around.
That's it, yeah. Hey? It makes your working day doesn't feel really like work when you come in. You've got a nice team, nice reception. Everyone super friendly, and that's the feedback we get from all the patients, is that, you know, it's not, you know, your typical, you know, GP receptionist, you know, system says no. We try and accommodate the patients, we try and get them in, you know, we try and work around them, even if we've got, you know, we're very fortunate we have full days or busy days, but we'll try and get the patient in when we can, do our best, you know, to get them treated, seen to, and
Talking about full days, he's got a full day right now, so we won't take too much of your time. All right, thank you.
All right, guys. Cheers.
Thank you. So it's a wrap. This is our Wilmslow 2 completed. Hopefully we can give you a little insight into our other sites, Liverpool and London soon. Look forward to seeing you all. Let's get on with a very busy day ahead.